I'm JuliAnne Murphy, and I'm here today with Dr. Courtney Carmack from Hope Family Chiropractic here in Little Rock, Arkansas. And this is part of a brand new series that I'm doing on different resources for women with cancer. So today, Dr. Carmack is here with me to talk specifically about chiropractic, because I believe that many times when women get cancer, they kind of forget or don't think about the normal things that are out there to help them. And I think chiropractic is one that's commonly overlooked. And it certainly was not something that I originally considered going through my cancer journey. And yet I did. So that's one of the reasons I wanted to talk with you today. So thanks for the opportunity to be with you.
Yep, really excited to be helping.
So let's talk first about you. You are here in Little Rock, Arkansas.
Yes.
Where did you go to chiropractic school?
Yeah, I went to chiropractic school. I graduated from Northwestern Health Science University out of Bloomington, Minnesota. Is where I went to chiropractic school.
All right, awesome. And then how long have you been here and had a Hope Family?
Yep, I've been
practicing in Little Rock.
Practicing in Little Rock since 2012, and I purchased Hope Family Chiropractic in 2019. So
Great.
I'm newer into this location, but I've been practicing here for over 7 years.
Congratulations.
Thanks.
And so for those of you that don't know this location yet, we're going to drop a pin kind of at the end and with this post so that you can find Hope Family and Dr. Carmack here. You're at the corner of basically Markham and is this Shackelford?
And Shackelford,
Yeah.
Yep.
So very central in West Little Rock for those of you that are seeing this. So let's talk first about services that women, and this could be men as well, though my focus is mostly women, having been a woman that's gone through cancer. But in fact, you have some history with cancer as well in your family. Do you want to share about that?
Absolutely. My husband, he is a 2-time cancer survivor. And so just hearing his journey, we weren't married when he had cancer, but just to hear his journey of going through treatment and types of things that he is now dealing with, health side effects because of those treatments, that what we're going to talk about today is really just speaks true to a lot of things that chiropractic can use to help people who either are currently going through or have been through cancer treatments, just to help them be as healthy as they can.
Okay, and I'm sorry about your husband.
Yeah, thanks.
I'm sorry for anyone who has to go through this journey, but unfortunately, these days, especially women with breast cancer, it's 1 in 7. And in other countries, sometimes it's as high as 1 in 5. But here in the US 1 in 7. That doesn't include other types of cancer. So general stuff that you guys offer here.
Yeah.
So you do chiropractic adjustments, you have massage, what else do you have?
We also do therapeutic exercises depending on what a patient needs. So that can range anything from doing range of motion exercises if they have loss of mobility or restriction in the spine or body. We can also do electrical muscle stimulation if people have a lot of muscle spasm, or maybe they are so mobile that moving hurts. We can also do traction or decompression as well, depending on what a patient needs with that.
Okay. I don't know what all those things mean, but we'll find out. So I think let's talk first. So my particular case was breast cancer that metastasized to the rest of the body. At this point in time, I'm cancer free. Hooray! But I think what's important to know to this conversation, and you don't need to go into what kind of, you've treated other patients with many other types of cancer,
Yes.
correct?
Absolutely.
I think a big question that many people have is chiropractic safe when you have cancer?
Absolutely. And of course, depending on the type of cancer, where it's located in the body, our treatment can range and differ greatly depending on the patient's needs. So, but of course, we are absolutely safe for anyone who is going through cancer treatments, and depending on positioning, a person's comfort level, a person might not be able to lie on their stomach or on their back, so we could do seated adjustments or treatment different ways as well. So again, a lot of that is going to depend on the type of cancer and then the individual person and what their body needs and where we find misalignments. But one thing that is really cool in chiropractic is that we tend to think of chiropractic for neck or back pain, but sometimes we don't understand and always realize what the body does biochemically after an adjustment. And so being a biochem major in undergrad, it was really cool. There's a study that when your body gets adjusted, you release interleukin, which is one of the parts of your immune system that actually helps fight viruses, bacteria, and cancer. And it's what the immune system cells use. So it starts that cascade. So after an adjustment, you can actually boost your immune system as well, which is really cool.
Okay, interesting. So I was thinking of it more from this, so thank you, because that's new for me to know. I was thinking that often going through cancer treatment, which as you know is quite tumultuous, and the patient never feels good. It's not, some people tolerate things better like chemotherapy than others. I had a heck of a time. I couldn't get out of bed. I barely could even get to the doctor. My husband had to be my full-time caregiver. And that was a huge, it was not only very humbling, it was just very difficult. So at that point in time when I was going, this has now been almost 2 years ago, when I was going through chemo, the thought of being manipulated in any way made me want to puke. So It wasn't something I could really think of. Now, at the time I hadn't met you, so I didn't see you, but I did go to another chiropractor, but for me, very sparsely. So I would go like once every month, and she would just have me lay flat and do some very gentle adjustments on the neck and things like that. So if somebody's going through a situation in a treatment where they're feeling nauseous or feeling some dizziness or things like that, how do you go about that? How do you go about treating that?
Absolutely. If a person does have a lot of dizziness, whether they're going through cancer or not, unfortunately, dizziness and vertigo is a lot of patients. So some chiropractors have tables that actually will raise and lower. Well, if someone's having dizziness or a lot of nausea, that can almost feel like you're going on a roller coaster, even though it's not moving that fast. So we can always put the table down and the person get on so they're not having to move with the table. Okay. Another thing we can do is if they're not even able to lie down because of that, some people, as soon as they get on their back, are going to feel like the room is spinning. We can adjust them seated in a chair as well. Okay, and we'll probably show in a separate video some examples of that, just to give you a tangible look at what that looks like, because I think that's important for people sometimes to get a visual. Okay, so how does chiropractic care need to be altered for women with cancer? We've talked about physical position, maybe being in a plain position, maybe being in a chair. What else should we keep in mind? And if there's tenderness or anyone post-surgery, if you have had a port put in or anything, for example, that's going to be really uncomfortable. So we have pillows that a person can lie on, or we could do all adjusting just on the back. So again, depending on comfort level, we're never going to do anything that goes beyond a patient's comfort level, because that's obviously, you're going to be tense, and that's not going to be the goal of treatment. That. So, and that need can be dependent or vary per visit as well. And so thanks for bringing up the port, because since I've had mine in, I've kind of blocked it because it was very painful and very uncomfortable during a lot of these types of things. But I was seeing you when I still had my port for several months. And often what worked for me was laying on my back, but not necessarily being on my stomach. Absolutely. And we could do the full range of care with me being on my back, which was great because my port was right here. Some people have it in their arms, on this part of their arms. Mine was here in the top, and any pressure on that, I couldn't sustain or take any pressure at all. I couldn't even lay on my stomach without having an arm kind of to cover it. So, and I hadn't been in for almost a year. So for those of you that are going through cancer and have ports or other treatments that are having to deal with a port, you can still get the treatment you need and be comfortable. And for me, that was a huge deal because I think we even talked about the first couple times I came in about the fact that I had the port, and you would even say, how does this feel? Even when I was on my back treating me, if we had to do a couple of, crossed arm things or whatever. Absolutely. And it worked great. The other thing, and we'll show this also in the second video that accompanies this one. Having just had myself 10 weeks ago a double mastectomy, having both breasts removed, I was nervous coming back, which I didn't do, I guess, till about a month out after the surgery, because clearly this area with the incisions, the chest wall is very sensitive. For quite some time, I still have sensitivity, and I'm not even, I'm 10 weeks out. So what do you do with that? Absolutely. And so we have a pillow that actually has a cutout in the middle that we can use. That way there's not any pressure on the chest at all over those incision scars, because that skin is going to be tender for several months just because it's brand new skin and with the scar tissue with there. So that way we don't want there to be any type of pressure on those scars. And so whether we use a pillow, whether we have other like Bosus or other kind of support or pads that we can put underneath just to help make that more comfortable. Okay, so we'll look at those in the second video so people can actually see and touch them. Okay, what about, you guys also offer massage? We do. So let me ask you about massage, because clearly if somebody's going through chemo versus having had surgery versus maybe just doing radiation, he or she might not feel comfortable. They might not think, well, I can't do massage, just like they might have thought I can't do chiropractic care. What's your thought on that? Absolutely. Massage is a great healing tool, especially for people if they have had any type of radiation, or maybe they've had some lymph nodes removed, if there's any type of lymphedema. Massage can be really great at help getting the lymph to disperse. And And massage is very similar to chiropractic in terms of there's different positioning that can be used. Any practitioner, they can do different types of pressure depending on the patient's needs or desires, but I would say helping with comfort and tension, but also scar tissue. If anyone is post-surgery, working with scar tissue, because that tends to be really tight. Massage is not only stretching, but massage can be a really great tool after surgery too.
Okay. So but generally, probably maybe some of the typical face down, especially if you've had surgery, or, I mean, are there specific positions, and we're not going to show that today, but are there specific positions that, or would you only do certain parts of the body that you might not do a full body, you might just do other types?
I think it would also depend on what the person's needs are. If they're coming in with pain, that might be the focus area if they're having a lot of tension in the upper back. But also, like, we can do seating and chair. We have a chair that you can be massaged in.
We see them in the airports.
As well, all over the place. So you can do chair massage, or you could do, just on your back, just on your stomach. But then if there are areas that are sensitive, avoiding those. I mean, you wouldn't go right over a scar a couple weeks right after surgery or anything like that.
Okay, so pretty much everything can be completely customized, it sounds like, depending on the needs of the patient. Okay, let's see. Let's talk about some of the side effects that come often, especially from chemotherapy, some of the nasty side effects that can happen. So I'm just going to make a list, but we'll go through each one.
Okay.
So this has not happened to me, but often when you've had surgery or even radiation, you'll get a frozen shoulder, right? So we'll talk about that in a moment. Lymphedema, which we talked about, we'll talk about it again in a moment, which is when some of the limbs, especially the arms, after having lymph nodes removed, swell, and that you have to wear sleeves for them and things like that. Headaches is a common side effect, especially with chemotherapy, nausea, clearly, and also neuropathy. And then any others you got. So let's talk about each of those. Frozen shoulder. So I have a friend who went through her mastectomy now. Actually, I think she had a lumpectomy about 2.5 years ago, and then had 30 days of radiation, which is common. And to this day, 2+ years later, still has frozen shoulder. What would you do with a patient like that?
Absolutely. So first thing is doing an exam. Not every patient with frozen shoulder is going to have the same underlying root issue of what's causing that. The hard thing after a procedure like that is they do instruct you and need you to be immobile for that. So a lot of that immobility is what's going to trigger the muscles are going to tighten up. Joints, unfortunately, in the body, as a lot of us know, during certain periods of inactivity, muscles are use it or lose it. And so when we don't have that activity, those muscles can atrophy, lead to loss of range of motion. But I also find for a lot of people with frozen shoulder, or when they do have restriction, there's also ribs out of place in that top part. If you use any type of sling, it can add extra stress to other places, either in the lower neck, upper back, and even affect a rib that will then affect the range of motion of both the shoulder blade and the shoulder itself, leading to frozen shoulder.
Okay, and so those essentially could stay in place, ribs out of place, whatever, until it gets looked at by somebody.
Absolutely.
Okay. How does, we're going to sideline for here, which happens often when I do videos. How does chiropractic either work with or alongside physical therapy? Because a lot of people are confused between the two.
Absolutely.
Often let me just add, I know coming out of my mastectomy, I was given physical therapy exercises of a couple of pages or 3 pages to do on my own at home. And they said, if you have problems, let us know and we'll refer you to a physical therapist, which I think some places will automatically do that. But many people, I think, get confused. Chiropractic work. So talk to that a little bit.
Chiropractic is going to focus a little bit more on the structure and the actual anatomy of the bones and joints themselves. While physical therapy will have a little bit more focus on the soft tissues. If a muscle is weak, strengthening that. If there's a lot of tightness or restriction, then lengthening or doing stretching with that. So usually physical therapy has a little bit more focus on the soft tissues and not necessarily the joint or the bones.
Okay. So it could be then, from what you described with the frozen shoulder example, that if there's ribs out, a physical therapist may not be able to get into that because that's bone. So it could be that those two work together.
Yep, absolutely. And a lot of times in chiropractic, as a chiropractor, I have to address the soft tissues as well, because if it's been in a misaligned position for a long time, the soft tissues have adapted to that. So we will do some range of motion exercises, but the hard thing is that if the structure is off, the bones are anchors for muscles. So if the structure is off, no matter how much you stretch or strengthen a muscle, if that joint isn't where it needs to be, it's going to be really hard to get that range of motion back in the case, especially a frozen shoulder.
Makes sense. Okay, great. Thank you. What about lymphedema? We mentioned it, but go further into that.
And of course, being in line is going to help, but the biggest thing with lymphedema is like the compression, or just making sure that we can prevent it from pulling. Chiropractic can certainly help with alignment, but I would say for lymphedema, things like wearing compression or massage or dry brushing, those are going to be a lot better tools than necessarily, I wouldn't probably see a patient for specifically for lymphedema.
Okay.
But if there is any type of misalignment that might be causing the lymph to pool in certain areas more than that, then of course we'll address that. But I would say more, again, like the dry brushing, massage, those are going to be better tools to address the lymphedema itself. That's going to be more of a secondary.
Okay, good to know. Clearly headaches.
Yes.
I think everybody probably that knows anything about chiropractic knows that headaches are something you treat.
Yep,
anyway.
one of the most common.
And then my experience with chemotherapy was, and I did even have some headaches coming off the narcotics when I had the mastectomy. That the headaches can be debilitating. I'm not a person that normally gets headaches. I've never suffered from those like many people do. But the chemo, clearly you're putting a lot of chemicals in to kill cancer cells and also sometimes other things, but can make it extremely challenging. So do you treat those types of headaches the same as you would a regular headache, or how does that work?
Yeah, and so I'm always going to start with an exam just to see where the problem or the issue is coming from. A lot of headaches that are structurally based are going to stem from either C1 or C2 that is misaligned in the very top part of the spine, because those are the nerves that when they come out of the spinal column come back up and go into the head. They control blood flow, the amount of oxygen getting into the brain. So misalignments can certainly cause headaches, but chemicals can do that, dehydration can do that. You know, if a person is feeling nauseous, they're not able to drink or eat, that can certainly, low blood sugar can lead to headaches. So there's many different causes. So one of the things I have to be is also detective in figuring out what is the source of that. But if someone is having a headache because of coming off a medication or side effects of a treatment, getting adjusted is certainly not going to hurt the situation, but that's also part of the body just getting rid of the toxicity as well.
Okay.
Yep.
So obviously then fluids and staying. I would think for me, because I had so many symptoms coming out of the first set and second set of chemo, that I wasn't drinking enough. I was, and of course I had a lot of other gastrointestinal challenges. So the staying hydrated was a huge challenge.
It's a challenge for a lot of people too. I mean, if you're not feeling good, drink this 80 ounces of water today. You're like, no.
Yeah, right, exactly. Okay, thanks for the clarification.
Yeah.
Nausea.
Again, chiropractic probably not something that we would be the primary treatment for nausea, but just we can even recommend some nutritional things or herbs, things like ginger or peppermint essential oil can also be good to help aid that. So probably not something that we'll treat as a primary, but we can help to give some recommendations. A lot of chiropractors also do nutritional counseling or recommendations that can help aid people with those other issues and
other
health
supports.
Support systems for sure.
I will be doing a separate couple of videos with a couple other professionals on essential oils for cancer support, but that's not something you guys do here. So okay, great. And what about neuropathy? Now let me just speak for those of you that first of all, give us a definition of neuropathy. Can you do that from a medical point of view?
Absolutely. So neuropathy, when there's pressure on a nerve, typically a nerve symptom is going to be numbness or tingling. It's going to feel very different from that. So when there's pressure on a nerve, either from a chemical like chemotherapy, a misalignment of the spine, we also will see that is when they're actually with pressure on a nerve is that you lose the feeling of wherever those nerves are ending up. It's most commonly in the end part of the limb, so in the hands and fingers, in the feet and toes. So those are the most common areas that a person would have neuropathy, that you lose the feeling for that. And so again, it's most commonly in the arms and hands. We'll see that a lot in diabetics as well as cancer.
So not just
patients.
cancer patients. So let me speak quickly about my own challenges with neuropathy. When I had chemotherapy, interestingly enough, I had 6 sessions of chemotherapy. It didn't come out until like the 5th or 6th, but it has continued since then. And you and I have had conversations about it. I have it in my right foot, and if this is the foot, it's kind of right here in the middle of the foot and extending into the fourth digit, the fourth toe. And it comes and goes, it's not constant. And it's tingling and kind of buzzy feeling, and it can swell up a little bit and be very painful. And so that's one of, sadly, an unfortunate side effect for many, many, many people of chemotherapy that often, because of those chemicals, doesn't ever alleviate. So how do you, when you have a patient like that, how can you help them?
And there might be, again, chiropractic might not necessarily solve the issue, but help make that more comfortable. If we can ease, if there is pressure on that nerve from the spinal column or pelvis itself, if it's going into the feet, alleviating that pressure, they might get temporary relief or notice that the intensity or frequency after an adjustment isn't the same. The hard thing is that if those nerve endings have been destroyed with the chemical, that it may not come back. I know several people, my husband, for example, after chemotherapy, well, he now has hearing aids because it also destroyed the nerve and hair cells in the inner ear. And so some of those side effects are going to be long-term, but we can help mitigate those symptoms. And some people even just have either relief, or even if it's temporary, of those symptoms after an adjustment or treatment.
There's a lot to consider, as you know, for those of you going through cancer treatment, or have a loved one that is and are the support giver or the caregiver. There are a lot of, sadly, side effects of chemotherapy and even of surgery, like the lymphedema and cutting of lymph nodes and things like that, that can be quite challenging. Is there anything else you'd like to do before we close this video? We are going to do a second one, so you hang on for that.
I think we covered it.
Well, thank you very much. This has been very educational. But tell us how people can find you, if you have a website, Facebook, phone number, all that stuff.
Yeah, absolutely. So we are Hope Family Chiropractic. Our web address is hopefamilychiropracticlr.com. And you can, our phone number is 501-217-9355. I almost forgot the phone number.
217-501-217-9355. Okay, very good. And are you guys on Facebook as
We
well?
are. I'm working on merging those. I am not great at social media. Well, like I know you are very good at social media. So
we'll be talking about that separately.
Yeah, we do have a Hope Family Chiropractic page that I'm trying to merge with the previous business that I bought as well. So we do have a Facebook page that will soon be a lot more interesting than it is currently.
Great. Okay, good. And you guys are open 5 days a week, 6 days a week?
We're open 5 days a week. And of course, by emergencies, we certainly can see people on the weekends, but we're typically Monday through Friday.
Awesome. Yep. Great. Thank you so
You're welcome.
much. Super, super excited to have been here with Dr. Carmack, and be sure and catch video number 2, which we're going to do in just a moment, and you'll see it on YouTube as well as Facebook and other places about some of the mechanics that we've just talked about. Thank you so much. And for more, JuliAnneMurphy.com. Ciao.